All right, good morning. I'm Brittany Clampett, Communications Coordinator with Sedgwick County. Thank you all for coming. Today we'll be hearing from Claudia Blackburn, Director of Sedgwick County Health Department, Dr. Francie Eckengren, Chief Medical Officer with Wesley Medical Center, Dr. Maggie Hagen, Infectious Disease Specialist with Via Christi, and Laura Labarca, Administrator for Hospital Operations at Via Christi. Please hold your questions till the end, and Claudia, if you'll get us started.
Good morning, and thank you for being here this morning. So I want to describe to you our current situation in Sedgwick County. We have many reports of influenza-like illness, and they have put the local hospitals at capacity. So at this point, half of the cases of influenza-like illness that we're seeing in Sedgwick County are influenza, H1N1. And the other 50% of influenza-like illnesses that we're seeing are other viruses. All of these viruses have very similar symptoms, which include headache, fever, tiredness, which can be very extreme, dry cough, sore throat, nasal congestion, and body aches. What can you do to help stop the spread of disease? Well, the most important thing you can do is get vaccinated. Get a flu vaccination. There are still some flu vaccines left in the community. There are many local pharmacies that still have vaccine. The health department has a limited supply for uninsured adults and uninsured and underinsured children. There are a number of healthcare providers that still have vaccine and some of the community health clinics as well. So you may need to call around to check first, but we do encourage you to get vaccinated. We will continue to see flu activity for, it could be 4 to 6 weeks or through April. It's very unpredictable, but there is time still to get vaccinated. The other thing, you've heard us say it over and over again, but wash your hands, wash your hands, wash your hands. That is a very important way to stop the spread of influenza as well as other diseases. And when you cough, cough into your elbow instead of your hand so that you don't shake hands with people, touch things, and then spread your disease. Also eat healthy foods, get plenty of rest, stay home when you're ill to avoid spreading the virus. If you have flu-like symptoms, make sure that if they're severe enough, you contact your medical provider, that you get enough rest, try to take care of yourself if you can, avoid alcohol and tobacco, and use an age-appropriate fever-reducing medication. So at this point, I'm going to turn it over to Dr. Eckengren, who is going to tell you about the Wesley situation.
Thank you, Claudia. Wesley at this time has maximized our resources. We have beds available and staff available, but are limited in some of our critical care areas at this time. We do have 2 campuses, both Galicia Heart Hospital and our main hospital. We are taking all patients that are adult medical. We are taking trauma patients. We have pediatric beds right now. We also are obviously finding beds for all of the patients present to our emergency department. We are very confident that the control center here at Sedgwick County is appropriately sending patients to the right resources in our city, so we're not in this alone. All of the hospitals are keeping up a bed board, and the EMS crews know where the beds are available in this city. So Wesley's ready to take care of the patients that present to us, and certainly working in close step with the other hospitals in the city and EMS. We would ask that people who are ill, please don't come to the hospital to visit others, and please don't bring children up at this time. We'd like to keep the infection of other people in the community at a lower rate, and as Claudia was saying, all those things that you can do to decrease exposure to yourself and exposing others if you're ill. Please pay attention to that. Thank you. And now I'm to introduce Maggie Hagen, our infectious disease specialist.
Thank you. I want to talk just a little bit more about the virus that we're actually seeing. As Claudia mentioned, we're actually seeing a variety of viruses, but in terms of influenza, which is at least half of the viral illnesses we are seeing, we tend to be seeing primarily the H1N1 strain, which is the virus that we first all became familiar with in 2009 when we had the pandemic of H1N1 infection. This virus has a variety of clinical presentations from a fairly mild illness to a very severe illness. And currently at Via Christi, we have about, I think, 18 patients as of today hospitalized with influenza H1N1. We do see other respiratory viruses as well. They tend to be a less severe illness. As Dr. Eckergen mentioned, we discourage people from visiting our patients in the hospital if the visitors themselves are suffering from viral type illnesses. We certainly don't want to spread that to our patients. We also encourage our employees to call in sick if they're ill with similar symptoms. We do vaccinate all our employees as a protective measure for our patients, so that helps us prevent spread from employee to patient. And we do practice isolation in the hospital. If you come in and you are diagnosed with influenza, you will be put in isolation such that people who come into your room will have to wear a mask to prevent spreading that to themselves and potentially to other patients. So we are very aware of our situation in the hospital and trying to contain it. Sometimes the illness is very severe, and every year we do have deaths due to influenza or due to pneumonia as a complication of influenza. That's watched very closely locally as well as nationally, and there's good information on the CDC website about the current epidemic. I can tell you that just as of today, the CDC has reported that the few strains that they have been able to test so far this year of the H1N1 that's circulating is the same strain that's in the vaccine. So we know that there's a good match there. So again, that would prompt us to encourage you to get the vaccine if you have not received it yet. It's not 100% protective, but it's a good vaccine. We think this year there is a good match between the strain that's circulating and the strain that's in the vaccine. So that's very important to know. And now I'm going to introduce Lori Labarca from Via Christi.
Good morning. Via Christi is able to accept patients, both medical and intensive care patients at this time. That is ever-changing element. We monitor that every 30 minutes internally within Via Christi of all of our campuses for a capability of accepting patients. We also update here the emergency management system in regards of bed capacity. So that the community from an EMS standpoint and county from a state element know what a bed availability is at each location. So we'll continue to do that. Our plan right now is to do that on an hourly basis outside of Via Christi so that we have community involvement so that coordination continues so we can best serve the community as a whole. We have program elements that we protect also in regards of cases like trauma, burn center patients, so that we make sure that we prioritize those because other options are out of the community for that if we're not able to accommodate that. So we'll continue to do that. We have 3 locations, so our St. Francis location, our St. Joseph location, and our St. Teresa location out west. So at this point, we're accepting those patients and then coordinating within the community.
Okay, so just to reiterate what we're dealing with right now, our current situation is that we have many reports of influenza-like illness in the community and that our local hospitals are at capacity. And we know that people want to know when they should go to the emergency room. And sometimes it's not always clear, and I think somebody maybe picked up my notes. Okay. So it is appropriate to seek emergent medical care if you have any of the following signs and symptoms for severe disease: worsening or significant difficulty breathing, not waking up or interacting, feeling faint or confused, having a fever with a rash. If it's an infant, having significantly fewer wet diapers, like maybe only 1 or 2 a day. And in adults, pain or pressure in the chest or abdomen that's not related to coughing, and then severe or persistent vomiting. These are signs that you need to seek emergency care. Other than that, if you're just a little bit sick, or if you have the flu, or you have signs and symptoms of the flu, and you have some kind of chronic disease such as lung disease or asthma or something else that makes you really high risk for complications, the best thing to do is to contact your healthcare provider early on so that you may get an antiviral if that's indicated, and that can help to shorten the course of the illness. And if at all possible, stay home, take care of yourself, go out only to get your absolute necessities, and stay home until you've been fever-free without any fever-reducing medication for 24 hours. So we really don't want people to go to the emergency room if they're just a little sick, because if you're just a little sick, you may very well catch something and get sicker, and if you have something that's contagious, you may spread it. And they're very busy at the hospitals taking care of people that really need that kind of care. So that's what we have today. And again, get your flu vaccination, wash your hands, cover your cough, and take care of yourselves during this flu season. Thank you.
Right now, if you have any questions, you feel free to ask those if you ladies would come up here and make it a little easier for everyone.
Have there been any significant changes that have caused this meeting to take place today? Or is it just a matter of, hey, we told what Christi was going through, and now we're just going to give you the briefing of what everyone's going through right now?
I think that's exactly right. This has become, pandemic. It is citywide, and resources are stretched, and we want to be sure the community knows about that and feels safe in their own community. EMS is rolling to any distress calls, and we're then trying to decide where the best placement for that patient is. So it's really just about making sure the community knows that we're at this point and it's all being discussed, but we have a plan.
And then just to follow up really quick, I know before we were talking earlier, we've been talking about the possibility of being turned away because hospitals are seeing themselves at capacity. I know last week they were saying, no, we're not turning away anyone from any of the hospitals at this point in time. Just figuring out, is that still the situation right now?
Right.
That's where we're coordinating from a community standpoint, that we had at times maybe one of the hospitals were at capacity at a certain area, but the other one was able to relieve that surge, if you will. Now it's taking a coordinated effort between all of us. That's why we have down here the coordination of all the bed availability, so that EMS has on the road, knowing what that bed availability is, where to go for what's available at that point in time, because it can change within 15 minutes. Within a 35-minute period of time, we had 20 walk-ins at our St. Francis campus yesterday. So it can be very fluid for us, so that's why it's one point in time of a number and then that we're staying on top of it. It's now taking the community coordination. We're also adapting throughout the community elective procedure situations, regards of procedures to help us to manage the need, as well for us to look at extended hours of immediate care, so the right level of care is important, so that we don't have the wrong level of care being provided to individuals that might need that level of care.
Are we, I don't know who needs to answer, are we seeing all ages, or is there a certain age criteria that we're seeing more of?
I think we are seeing all ages. We tend to see older people being hospitalized with influenza-like illnesses, but I will mention that this particular strain, the H1N1, when we first saw it in 2009, the population that seemed to be hardest hit was the young adult, older teenagers, college age, young adult, and it's a little too early to know whether, when this is all said and done, that will be the same trend this year, but we are seeing some young adults that are ill, not quite as ill as our older or very young population, and those that tend to be hospitalized tend to be the older population for the most part.
Is this about the right time when we see this outbreak, or is it
It-
later?
Well, it varies year to year. Last year, our Trend started on January 15th. The week of January 15th to 22nd was incredibly busy last year. We started a little earlier this year. My personal prediction is that we'll have a less steep but longer peak this year than last year, but it's a little too soon to know. As I mentioned previously, a lot of times we start to see an outbreak shortly after there has been close gathering of people, like after the holidays when people get together and then someone may be incubating the influenza and other people will be exposed. And so following just right after the holidays is not uncommon, but sometimes we see our influenza in October, as we did in 2009, and sometimes we see it in March. So it varies year to year, but this year is about a typical time.
I know that you just called this a pandemic. Would you say this is the first time you've seen something like this in a while, or have you had an outbreak just large to where all the hospitals has actually died?
I haven't heard CDC quite use the word pandemic yet. It takes a little while till we get that sort of reported, but when we know it's really spread around our community, then we know everyone is at risk. And that's typical most years with influenza, that we have this kind of fairly large outbreak. Some years we get lucky and we have a mild influenza season, but this year is not particularly unusual.
Of the number of people who have been treated at hospitals, do you have a number on people who did get a flu shot but did condone? Do you track those numbers?
We do not have those numbers on our patients. I think both hospitals have been very diligent about having our staff immunized, and we can keep records on that. We're all over 90%. We also have asked all the physicians in the city through a citywide effort to be immunized. So we've been very diligent about that, but we don't have stats on all our patients being immunized. At the end of this, we'll probably be able to pull some data because we offer every person immunization in the hospital, and so when we ask those questions, we'll have some data at the end. But
that's mainly for follow-up, just when you poll to find out whether or not. Is that kind of hard to track real time? Is more after the fact analysis type of thing? Is that what that would probably be?
yes, we just don't have the data tracking in place.
Can we talk about a contingency plan in case all the beds are taken? If we do run out, what will happen then?
We'll stay with Sedgwick County running the emergency center. We will reach out to other communities, obviously. We'll take care of the folks in our city first, and when people present to the hospitals, we will expand any capacity we can. And you heard Lori talk about that somewhat. If you have emergency surgery, we may keep the patient in the operating room on monitors. We may use our recovery area, which is not typically our patient care area, but we will expand into all of those areas. Any place there's a monitored bed, we'll use it. In the event we run out of everything, we'll bring in our portable monitors. I suspect that most of the ventilators that are available have already been reserved, and we've brought those in from different companies. But at this point, I don't believe we're out of ventilators in the city. So we have a lot of resources left. If we get to that point, we'll all be working together.
Right. We open up additional areas within our facilities to help for capacity. So based on our staffing and what the needs are, we also have what we'd say capabilities that we can rely on to triage patients that are dismissed and are needing a ride home, those types of elements to expedite that. But we have areas that that are part of our contingency plans right now before we would be completely exhausted from that standpoint, and other facilities within the community that we would rely on to access.
Obviously, when you're discussing a situation where you have bed availability that's really going down, when you have, when you're having to work together, I'm not saying it's difficult to work with each other, but I mean, what kind of difficulties are you facing from a staffing position, from a bed availability, just kind of in getting all this put together?
Well, as you can imagine, it's very difficult. It's difficult at each one of our facilities, and it's difficult citywide. At some point, resources are they're just taken up. But we have plans in place, and I would say that all of us drill this. We do hikes drills throughout the year, and that's why we do them, so that we're prepared for this. We have command centers at each hospital that are feeding into this center, and so we do prepare for just this kind of thing in the hospitals in the city. And I would say that, again, that we work very well together when we're in a crisis mode like this. It's all about the community and the patient care.
And there's a lot of activity that happens that's not so visible to the public, that happens on a routine basis, that's not considered an emergency type of situation or needing elevation that we've elevated to go to a community coordination. There's coordination already behind the scenes, especially for different situations of like ICU beds, also for trauma, those types of more limited services that get to capacity quicker.
I know you said that you can't obviously predict the future and know exactly what's going to happen, but you did say that you do think that this might be something that kind of, just stays consistent versus, having a huge spike here and then a spike here. If it does stay consistent and we continue to have this capacity that we're at right now, what kind of situation do you think we'll be in? Do you think that we'll be prepared, or is there anything that we've done to kind of, make more flu medication and things like that?
I really don't think we've had a problem with a shortage of flu medication. It's certainly not in the hospital at this point. So I think we're prepared for that. And whether the peak is steep and short or long and less steep, the volume may be about the same. So I think we're prepared to handle that, both in capacity in the hospital and with medications and other resources. And vaccine, we still have vaccine available. So again, the take-home message is if you haven't had the flu shot and you'd like not to get the flu, it'd be a good idea to get the flu shot while it's still available, because we don't know whether flu will still be circulating in 2 weeks or a month or 2 months from now in our community.
Can we just have Bree spell her name, please?
Everything that you need to know is in a packet in the back. They're all right on that shelf back there. It's everybody's name and titles as well. That'll be it for today. Thank you, ladies, for coming out, and thank you all for coming out too.